up, everybody? Dr. Garrett Wegerif here at Pure Plastic Surgery. Come check us out at pureplasticsurgery.com. You can see before and after pictures. You can book consultations. You can see all of our educational content that we do on a regular basis to help prepare you guys for your upcoming surgeries, whether it's with us or even with somebody else. But again, I'm Dr. Garrett Wegerif. I'm a double board certified plastic and reconstructive surgeon. And today we are going to be talking about expectations after the first week of surgery, or during your first week of recovery after surgery, what you can expect. So there's a lot of overlap between procedures, but there's also some individual things for one procedure versus another. So we're gonna kind of get started with some of the most common procedures we do. And one of my signature procedures is a drainless tummy tuck. What to expect from that during your first week. So one of the big things is just to, before surgery, to set your mind to be prepared for this kind of tough week, because you're gonna have some pain, you're gonna have some discomfort, you're gonna have a lot of swelling, you might have a limited appetite, but that's all part of the process. And when you're mentally prepared for it and you're thinking about it, you're just gonna go into it with a different set of eyes and expectations than someone who's totally unprepared, or someone who thinks it's going to be a completely painless process, because it's not. There's going to be some discomfort associated with it. And if you go in it with the right mindset, you're going to do that much better. So first day or the day of surgery, when you're going home, you're going to go from our post-operative care. Janet or someone is going to go over all your post-operative instructions with you and your caretaker, and you're going to be getting to go home. And the first thing you'll know about your surgery day is you're going to be up, moving, and walking the day of surgery. We want you to do that. With all of our procedures, one of the biggest things we fear is the risk of a blood clot that can form in your legs and go to your lungs. And the main thing you can do to decrease that risk is to get up and walk around. So we want you walking around, and that's what you're going to be able to do. All of our tummy tuck procedures now are basically getting the Exparel medication, which is the local medication I inject directly into the muscles. That's a long-acting local anesthetic that really cuts down on your need for narcotic pain medications. And that's really helpful for the first 2 days of recovery. Anyone who's getting a tummy tuck, you're going to be walking out of here hunched over like a little old lady like this, because we pull everything so tight. We tighten those abdominal muscles, and that's a normal part of the recovery. You're going to be that way for probably the first week. You're going to straighten up a little bit each day. You're just going to listen to your body and continue to straighten up as your body tells you it's okay to do that. By 1 week to 10 days, you're going to be standing up completely straight, but you still might feel a little bit of that tightness, and that's normal and that's expected. So post-op day, and you're going to have some pain, some discomfort. We send all of our patients, especially our tummy tuck patients, with pain medication and a muscle relaxer. The muscle relaxer helps a lot with the muscular plication and also just the discomfort associated with being hunched over like that a little bit. You're going to want to sit in a recumbent bed, or stack up a bunch of pillows behind your back, a few pillows behind your legs, so you can sit in a nice recumbent position and recover comfortably. Every hour while you're awake, you're supposed to be getting up out of bed and walking around for at least 10 minutes. And that, again, decreases your risk of blood clots. The other thing that's really important for you to do during those first few days is use your incentive spirometer, which is a special device we give you that helps you take deep breaths. Because another one of the side effects of tightening up those abdominal muscles a lot is people tend to take really shallow breaths and they don't fully expand their lungs. When you do that, you increase your risk for pneumonia. So the incentive spirometer is a little device that we give you that helps you take those nice, deep, full breaths so you can fully expand your lungs and decrease the risk of developing a pneumonia or some type of respiratory infection. All of our patients that are getting tummy tucks also get the VenaPro device, which is similar to what you would wear in a hospital. And it's a type of mechanical compression device you wear on your lower extremities, in addition to the compression socks. And these are battery powered, so we want you wearing them all the time. If you want to take them off for just a few minutes when you're walking around, that's okay. But whenever you're laying in bed, we want you to be using them. Keep them plugged in and keep them charged so they're functioning. And wear those as much as possible. And again, that's decreasing your risk for blood clot. For my patients that got a drainless tummy tuck, your post-operative garments, wearing your faja, And getting lymphatic massages is super important to the recovery process and decreasing your risk of seroma formation, or a collection of fluid that can form underneath the skin. So you're going to be starting your lymphatic massage on post-op day 1, ideally, okay? And you're going to be wanting to get that almost every day for the first 10 days, and then you can switch off to every second or third day after that. And then for the patients who got a traditional tummy tuck with drains, very similar recovery, except you're going to be wearing an abdominal binder instead of the faja for the first few days until the drains come out, because it's just a little less cumbersome than getting the full faja on. The abdominal binder just goes from your pubic region to just underneath your breast. And you're going to need to be keeping track of the drainage that's coming out of those drains. So all of the patients that are getting a traditional tummy tuck get 2 drains. And you want to record that output so we can see when those drains are able to come out. So make sure yourself or your caretaker is doing a good job to record that. Again, those first 2 days are kind of the toughest in terms of the recovery. That Exparel medication really helps with the pain control during those first 2 days, but then that starts to wear off. 48 hours after surgery is when we allow you to start taking non-steroidal anti-inflammatory medications like ibuprofen or Motrin, and then you can start incorporating that in with your Tylenol and then ibuprofen, so you're getting something every few hours. And so we're treating the pain from multiple different angles. You can still have your muscle relaxer to help with some of the discomfort associated with your back and muscle repair. And with those 2 medications, most patients can really start weaning off of the narcotic pain medicine within just a few days. So we're treating the pain as much as we can from multiple different directions to decrease the need for those narcotic pain medications that can lead to issues with constipation and lethargy and all those other things. So then the other important thing to do for the first few days after surgery is to stay very hydrated. People are often concerned about eating, the day of surgery or the day after surgery. I'm not really super concerned with how much you eat right after surgery, but I am concerned about with how much fluids you're taking in. We really have a goal of trying to get about a gallon or 2 liters of fluid per day, because with all the different procedures we do, you have a lot of fluid shifting around. You want to keep yourself well hydrated. So you want to focus on taking small sips throughout the day so that you can tolerate it and you're not feeling nauseous. All patients also go home with Zofran, which is a nausea medication that helps with the nausea associated with the anesthetic that usually wears off after the first 24 hours. So we talked about ambulating, pain control, hydration, and then, starting the day or 2 after surgery, you do want to start focusing on eating and nutrition. And the main thing you want to focus on is protein. You want your protein intake to be higher than it normally is, because everywhere we make an incision, the building blocks of healing all really comes down to protein. So start taking those, focus on having high protein meals to help with your healing during that process. Some differences with different procedures that we do, liposuction and BBL. So lipo 360, we're doing liposuction to the abdomen, the flanks, the back, sometimes with the arms and the thighs, often in combination with fat grafting to the hips and buttock. So the recovery for that is somewhat similar to the abdominoplasty, but some of the things you want to be focused on for that is staying off of your butt. So whenever we transfer fat, it's been disconnected from its native blood supply and it needs to reestablish a new blood supply. So even a few minutes of high pressure from sitting on your butt can kill the fat, make it not viable, and then you're gonna have a suboptimal result. So we want to really focus on staying off of your butt. So standing or laying down for all of our BBL patients. Again, lymphatic massages are super important during those first few weeks after surgery, especially the first week. It really helps a lot with everything. Constipation is kind of one of the things patients deal with during the first week of surgery, related to the anesthesia and the narcotic pain medications and just the pain from surgery. So all of our patients get a stool softener. You want to start taking that right away. Some patients, if they haven't had a bowel movement within the second or third day after surgery, we start talking about adding something like Miralax to make sure we get things moving so you don't have an issue where you're really dealing with bad constipation a week out from surgery. I think that's a good basic overview, or I guess we'll touch quickly on breast procedures. Breast procedures in general tend to be tolerated really well, especially breast reductions or breast lifts without implants. The pain associated with it is pretty minimal. Question we often get is how high you can lift your arms. I'm totally okay with patients lifting their elbows up to the level of their shoulder so they can still wash their hair, wash their face, put a shirt on. I don't want you lifting straight up during that first week after surgery, but you're going to be able to do all your activities of daily living with a breast procedure as well. Any procedure that has implants, the discomfort is a little bit more because you have the pressure of the implants, especially if we're placing them underneath the muscle. So again, we give all of our patients muscle relaxers to help with that, and they're usually able to wean off of narcotic pain medications within 1 or 2 days after surgery as well. A lot of patients don't need any narcotics at all for breast procedures. So with that being said, I think it's a good brief overview of kind of what to expect for the first week after surgery. Do we have any questions out there from the audience?
How many days should I stay there if I'm from out of town to get a tummy tuck?
So out of town, you want to stay a minimum of 5 days after your surgery. So we want to plan on about 8 days because we need to see you the day before surgery for your pre-op visit, the day of surgery, and then at least 5 days afterwards. So plan for about 8 days total to be in town.
And
the longer you're around, the better, in my opinion.
And in your opinion, how many massages should I get?
Depends on the procedure, but for any liposuction or drainless abdominoplasty procedure, I really want a minimum of 20 lymphatic massages. If you're getting a traditional tummy tuck, I say a goal of 10 massages is ideal. But it's one of those things where kind of the more, the better for your recovery and your ultimate results.
A sweet lady named Mrs. Scott wrote, Dr. G is the best doctor and an amazing human. To obtain the best results, the massages are an important factor. Obviously, follow the protocol he gives you. He overachieved my expectations.
Awesome. Well, thank you so much for the kind word. I'm glad you're doing well.
Would we have to set up massages ourselves?
So we can help you do that here while you are in Miami. We have Jess, who is our in-house massage therapist. She's excellent. And we can recommend some other places around, but we can definitely help you with that when you're in town. If you're from out of town, there's different parts of the country. Lymphatic massages are more available than certain parts. So most major cities, it's not a problem to find it. If you live in a more rural area, you want to start doing some research so we can start working on that before you go home so we can get you the best result possible.
Do you only do drainless or do you also do drains?
I do both, and it depends on a few factors, but really the main factor is if you think you can tolerate drains, we can do the traditional. If you think that's absolutely not possible, we can do the drainless technique. The two things with the drainless technique, it takes a little bit more time in the operating room because I have to put extra layers of sutures, and the cost is a little bit more because of that extra time.
Awesome. And Lindsay said, I can't wait for my turn.
Awesome. I can't wait either.
And that's what I'm doing.
All right, everybody, thank you for tuning in. We did this a little early today. I have some afternoon cases, so I hope you all have a great rest of your week and weekend, and I will see you next week for Thursday Thoughts.